Hello everyone, welcome back to my channel. My name is Reetahh and this is Tea Spill with Reetahh. On today's video, I'm going to be talking about cervical cancer and how you can prevent this. I know a lot of us have been wondering what really is going on, why is cancer rampant? We'll get to know more as time goes on. Cancer basically is when there's an abnormal growth of cells and these cells begin to spread through different parts of the body. So cervical cancer is cancer of the cells in the cervix, and the cervix is the opening of the womb or the uterus. It's like the entrance and the exit. It's the gateway of the womb. So when abnormal cells begin to grow in that area, this is where the whole cervical cancer comes in. In Nigeria, cervical cancer is the second most frequent cancer, and this is to tell you how deadly this disease is. Who are those that are at risk of getting this? Smokers. Smoking actually has a lot of dangers to our health. Also, there's this virus known as human papilloma virus, HPV. It's a sexually transmitted infection, and there is the low risk and the high risk. But what we are concerned with is the high risk HPV, because that's what causes 99% of the cancers. Also, prolonged use of oral contraceptives. If you're using those pills for a very long time, you are prone to having cervical cancer. Then if you have a family history, maybe your mother has had this, your grandmom has had this, or someone in your family has had this cervical cancer, you are actually at risk of also coming down with cervical cancer. HIV actually weakens the immune system, so the immune system is unable to fight certain infections. So those that have HIV are actually at a high risk of getting cervical cancer. If you've had sex before the age of 18, you are also prone to having cervical cancer, or you have many sexual partners. Let's just go to the signs and symptoms. There are actually no symptoms at the early stage because this disease develops slowly over time. So at the early stage, you might not really notice any signs, but when it starts progressing and when it starts, getting to that advanced stage, you start seeing signs like vaginal discharge or bleeding after menopause or in between your periods or after sex. Also, there's pelvic pain, abdominal pain, there's backache, swelling of the legs, and so on. So what are the preventive measures that you can take? Earlier I spoke about the HPV, human papilloma virus. Basically, how you can actually prevent this is getting the HPV vaccine. The HPV vaccine actually prevents against some cancers caused by HPV. So getting this vaccine is actually very crucial, and it's recommended between the ages of 9 to 26 years of age, and it's really effective during this period of time. But if you are older, like 30 and above, you can still get this vaccine, or even if you're sexually active. That is what studies have shown, but it's advisable if you get them at an earlier stage. So if you haven't been vaccinated, please do get vaccinated with this HPV vaccine so you don't come down with this problem. Second is cervical cancer screening. This is where we use the pap smear test and the HPV test. A lot of you might have heard of pap smear test because there's a lot of awareness being made about this cervical cancer and people getting tested, which is actually very good. So if you are sexually active, you need to get a pap smear test, and this is actually recommended once in every 3 years. But if you are older, it is recommended that you get tested every 5 years. The pap smear test is actually to detect cell changes in your cervix before they actually become cancerous. So please do get this test done. Meet your healthcare provider and speak to them about these things, and they'll give you more information about it. The next is having several sexual partners can actually predispose you to having this virus because you don't know who is the carrier, you're not getting tested. So it's advisable that you have one sexual partner. But if you do not want to have one sexual partner, please practice safe sex by using condoms, or you abstain until you are sure of your partner or until you get married, preferably. If you fall in the category of the risk factors, you need to try and see how you can work on them. Like if you are using the oral contraceptives for too long, you need to stop taking them. Look for another means. There are so many types of contraceptives which you can use. Maybe I should do a video on that. If you want me to do a video on contraceptives or family planning, please let me know. So that's a wrap for this video. I enjoyed talking about this topic, and I know I might not have covered a lot of things, but just let me know what you are curious about in the comment section and I will reply you. Before I go, I would like to thank you guys for getting me to 200 subscribers, and please don't forget to continue sharing the love so we can keep growing and growing. Thank you. See you in my next video.